Welcome. In this presentation, I'm going to be talking about how effective transcranial direct current stimulation or tDCS on major depressive disorder. But before we jump in, what's tDCS? tDCS is a non-invasive method for brain stimulation where two electrodes are placed on the scalp which then creates a small electrical current and deliver it to a targeted area of the brain. It was initially developed as a treatment for brain injuries, but studies have found the use of it in treating neuropsychiatric disorders such as a major depressive disorder. tDCS is used as well to enhance cognitive performances. Major depressive disorder is also known as unipolar depression. It is characterized by long periods of sadness with feeling of hopelessness. People with this condition often have negative and suicidal thoughts. As cited by Lieber, the lifetime incidence of depression in the United States is more than 20 to 26% for women and 8 to 12% for men. Patients with MDD have interhemispheric imbalance, having low brain activity in left hemisphere and high brain activity in right hemisphere. This imbalance is related to differential emotional judgment towards negative aspects. Stimulating the left dorsolateral prefrontal cortex with nodal stimulation increases the cortical activity in this area, enhancing the executive functioning in working memory and identifying positive visual material. Using anode electrode over left PFC and cathode electrode over right PFC simultaneously enhances left PFC activity while decreasing the neural activity in right PFC. tDCS can induce neuroplasticity, which is weakened in depression. Many studies have produced positive results on the efficacy of tDCS on MDD. Studies conducted by Bogi et al. In 10 patients found an average reduction of 40.4% in the Hamilton Depression Rating Scale after a nodal tDCS versus 10.4% in placebo stimulation. Hamilton Depression Rating Scale is an assessment scale that contains questions related to symptoms of depression. A different study conducted by Liu et al. Found that there was no superior antidepressant efficacy after 10 sessions of tDCS in 40 patients. However, in its second study, results shown a greater decrease in the Hamilton Depression Rating Scale after 15 sessions of tDCS in 64 unipolar patients. The application of tDCS to treat MDD seems to be effective according to many studies. However, there are still plenty of information needed to provide as to how it actually helps MDD patients. Future studies can focus on clarifying the influence of current electrical stimulation to the neural networks and how behavior changes in MDD patients.